wearing the shoe, you know where it's pinching you. There might have not been a conclusive result on what is happening to you or what you're experiencing.
Okay.
Yes, it happens sometimes. I don't want to delve into certain things, but certain things that happen sometimes. We meet some spiritual things in this business, but let's leave it at that.
Okay.
But let's go there. Let's not go there. Then secondly, the signs. If you want to know if you're having arthritis, I will give you some signs to look out for.
Okay.
Good. You have joint pain in the hands, joints, all your joints, right as your hands, your neck, your lower back, your knees or hips. These are the most common symptoms. Then the pain areas in the joints, in the hands, in the hip, knee, lower back or neck. You should just take note of these symptoms. Then pain circumstances can occur related to weather, the pain times. To weather, as in this weather. Sometimes, during the
cold,
the rainy season,
you hear
that's back here in our climate.
Yes.
Rainy season or Hamatan, sometimes it's
really cold.
Really cold and affects, the body system. And that's where I would advise most times when you wake up in the morning, whether it's hot season, whether it's a rainy season, whether it's a cold season, you warm yourself up with cold and with hot water or warm water.
Okay.
It's either you can use tea, whatever you're comfortable with, or just pure water if you can.
Okay.
Warm or hot, early in the morning, first thing in the morning, then last at night.
Okay.
It helps to improve bone issues, or arthritis, or whatever form of arthritis the person is experiencing. So that's one advice I would give. Then he should contact a physical therapist.
Okay.
Yes, what he has done is to go for medical assessment. Yes,
right.
That's one side.
Right.
But he should also go to a physical therapist, as a physiotherapist, and explain the situation, bearing in mind all these symptoms,
sharing the
symptoms I've mentioned. If he's experiencing any of this, or his own way he's feeling, he should meet a therapist to discern what is happening or what is not happening.
Okay.
Do you understand?
Right.
So that's it. You can't just jump to conclusion. You have to speak to a therapist one-on-one.
Okay.
Of course, there are certain things that I can't discuss with him on air here.
Indeed.
So he has to meet with a therapist one-on-one, and then he could take it up from there.
Okay. So what are the food or supplements that you can, and when I say supplements, I'm talking about
calcium.
Well,
calcium.
Things that can actually build calcium.
Calcium. And you can either go for calcium supplements.
Okay.
Or, because these days we don't have time. Most of the time you say you want to have balanced diet, this and that. Let's not deceive ourselves. Especially we that in Lagos here. You wake up 5 a.m. you're rushing it. So
you have so much activities lined up.
How do you have time for the balanced diet? So what you can do is to help yourself with certain supplements.
Okay.
Like calcium.
Right.
Then vitamin D. Now, because what vitamin D does, it helps you absorb calcium.
Oh, okay.
Yes. Sometimes you can absorb calcium and it becomes as in excessive in the system without your system absorbing it.
Oh.
So what vitamin D
does
is to help the body assimilate or absorb the calcium you're consuming.
Okay.
Then at least foods rich in magnesium is also good.
Okay. I have another message here, this time from Cisco. Hi Cisco, good to have you here. Cisco says he's been suffering from serious arthritis and it's been giving him some serious concern. How can he manage it? Is it something he can manage, or is it something that he needs further assessment on?
Well, like I always say, the first step to treatment is to assess the exact condition any sufferer is,
anyone is going through, right?
Going through, yes, you have to
Right.
access it, because that's what helps a professional therapist to ask for the doctor's report
First.
First.
Before attending to you.
And because you need to know exactly after you come back to us and tell us that they've gone for this and that, they can't find anything, then now we can now start going into our scientific process of trying to find out, hypotheses, and from there, from so many hypotheses, now get to a conclusion on what could have been, the cause. Do you understand me now?
Okay.
So, if he's actually suffering it, there are things he should do. Like I mentioned it earlier. Watch diet.
Right.
Try and take warm water. Just avoid anything cold.
In this heat,
Avoid
Dr.
anything
Ray,
cold.
how do you want us not to drink cold water?
Yes.
There's some table that you're shaking right now.
yes, I understand.
Right.
I'm even on the table you're shaking. I'm shaking rather. But there's nothing you can do about it.
Okay.
If your health is really important to you, I'm not
Right.
saying you wouldn't indulge, but like minimize it and ensure that you're subconsciously noting that you need to take more of warm or hot
liquid.
food. Even food, your food is meant to be hot.
Okay. So that's
The system needs more hot food than or
The
hot
cold.
intake than something cold.
Okay, so
Then exercises
Right.
you should do.
That's
like
what I wanted to
slow,
ask.
how do I call it?